We will utilize anything that's out there that's reasonable and has good evidence. One of those things is transcranial magnetic stimulation. We have used that before. We've used it for OCD, obsessive compulsive disorder, and major depressive disorder, and also for smoking cessation. So it's FDA approved for both OCD and depression, but there are things that you can use it for otherwise. And really the function of it is that you stimulate the brain so it puts out more serotonin, norepinephrine, and or dopamine. And so that's sort of how it works. Indirectly, you kind of can see where it's working because you put the electrodes on someone's nerve fiber of their brain and you stimulate it and you watch their thumb move. So you know you're at least right area. And they have a whole bunch of different TMS machines. They have things that will go deeper. They have things that will go wider. So there's a wide array of stuff. If people prefer not to take medication and they want to do it more so with the TMS, we have places we will refer people to. We don't do them anymore in my clinic. We do refer them out to get that done. But I think it's a great adjunct. And the problem with adjunct is oftentimes you still have to stay on a medication. Sometimes doing TMS alone just doesn't really do the job. And so that's unfortunate, but the data points on it are good. When you get people from one point to another, especially if they're depressed and you get them better, and they start seeing light at the end of the tunnel, it's always a good thing. In my field, we have things that are considered slow-acting antidepressants and fast-acting antidepressants. There's only two fast-acting antidepressants that I use, which is ketamine and also Auvelity is pretty fast-acting at 2 weeks. Ketamine treatments usually start working within about 5 minutes. And so it's really great to have those kind of things. The problem with things like ketamine is that you get great upfront results, but continuing down the road, oftentimes you need to be able to have maintenance treatment. You can't just get away with doing it and then it's done. The same thing with ECT. ECT is electroconvulsive therapy. Great modality for depression. People will get out of that by about 80% of the time. Medications work about 60% of the time. So ECT is great, but selling it to somebody is usually the hardest part. Getting somebody to go get ECT is very difficult. And I think that even the studies show that ketamine works as well as ECT. And even with ECT, you usually have to get maintenance treatment. So you're not going to escape maintaining in some way with severe depression, especially if you've had about 3 bouts in your life. One bout, you're about an 85% chance of having another bout. And that's not to say like when it's going to happen. It could happen in 5 minutes. It could happen in 50 years. Like I never know if you have one bout whether you're going to have another, but you have a high percentage chance once you've had a major depressive disorder to go on another one. But the good thing is TMS doesn't require much more than getting under a chair and having a treatment for about 40, 45 minutes. They are doing different protocols now where they're trying to do intensive TMS at about 8 hours a day with some breaks in between for 1 week. And there's finding that there's some good results with that. So I know some game in town that have been doing these kind of things. So it's really a matter of what your preference is. So depression is one of those things that can be handled with multiple different modalities.